Hello, this is our Swrk 612 Diverse Rural Areas presentation on opioid use in rural Kentucky by Madalynn, Maya, and Treasure.
So we are going to discuss opioid use and how it is such a prominent and very large issue that affects thousands. There are many increased rates of overdoses that happen, and there's a large amount of resources that are lacking in specific areas, especially in rural areas. We are going to discuss rural America, Ohio Valley, rural Kentucky, and then specific counties within rural Appalachia. And then lastly, we will discuss our intervention plan that we came up with and the strategies and how we think it can help opioid users. So to start, we're going to talk about America. Within America, we found a statistic that shares in 2016, 45,838 opioid deaths occurred throughout America. So that's a very large number. And we also saw that many deaths occurred within the Ohio Valley area and rural Kentucky as well. Specifically, rural opioid use is at a higher risk for deaths than the urban area. There are a lot of healthcare resources that are lacking in rural areas. We found that there's a low physician to patient ratio in rural areas, and then there are a lack of social and economic resources that many rural areas experience, especially in Kentucky.
So in rural Kentucky, we found that in 2019, Kentucky was one of the top 10 states most highly affected, one of the most highly affected states about the opioid crisis. Um, these communities are tight-knit communities, so a lot of these the residents of these communities know of each other, and they move as a collective. Minimal availability for children to become involved in extracurriculars due to the low income of the area, and then they don't have much access to just extracurriculars in general. There's a social stigma around addiction and recovery. Many residents in this area don't like or don't believe in recovery, getting help from outside guests, going to doctor's offices, stuff like that, just reaching out for help. And then drug sales are a source of income.
Just some more information we found while doing our research for our literature review. The Ohio Valley is the states Kentucky, Ohio, West Virginia, and Virginia. And this collection of states has a higher opioid use than the states surrounding it and any other states in America, just between those four. In 2020, 9% of overdoses occurred in the Ohio Valley. And then specifically in Appalachia, Kentucky, labor workers are more susceptible to opioid use. Since they have to work long, hard hours, it's very physically straining on the body, and to miss work isn't really an option when you need the money to provide for your family. So using painkillers and other sources of opioids is a way to keep going to work even when you have chronic pain. Rural Appalachia accounted for 54 counties of overzealous prescribers. That's just a lot of people overprescribing opioids, like I said, to the labor workers, mainly in the coal mines. And then the drug overdose age-adjusted mortality rate of 32.5 out of 100,000 is approximately 50% higher than the national rate, which again just shows that the overdose in Appalachia, Kentucky specifically is very high compared to the national average.
So when it comes to specific counties in Appalachia, we focused on, excuse me, Wolfe County, Breathitt County, Perry County, and Knott County. Wolfe County is ranked number one for being the most vulnerable counties due to the opioid pandemic. Breathitt is number 3, Perry is number 4, and then Knott is number 17. Rural substance use is most common amongst young white males with low education levels. I found that while researching. And then HIV and AIDS are prominent in these counties due to residents sharing needles and using dirty needles around the area. So there's a lot of dirty needles that are just thrown around the city, thrown around these communities, and people who are using drugs are just picking them up just because there's a needle available and using it without knowing who was using it and what is on that needle. Many residents in Appalachia are experiencing mental health and substance abuse. So they're really needing that dual diagnosis treatment just to address both of them, because a lot of their substance use is stirring from them dealing with mental health issues and problems. Rural residents don't have access to rehabilitation centers, detox beds, or mental health treatment. So there's no really any centers for them. Most residents are having to travel over an hour away just to receive the treatment that they need. Appalachian residents are uneducated on the different types of mental health issues, such as depression, suicidal ideation, bipolar, schizophrenia, stuff like that. So the residents are living with these issues and not knowing what they are, and they're just thinking it's okay without getting the help that they need. So in our assessment of existing services, we found what works and what doesn't work. So what works is availability of primary care providers in rural areas increases chance of discussion about drug use. So if we put offer more primary care physicians in these areas, then it will increase the education surrounded by the opioid epidemic, and it can help teach these residents about that so they can hopefully decrease the amount of use that goes on. So HEAT, which is the Heroin Education Action Team, spreads information surrounding the opioid epidemic and how residents can fight to end the epidemic. So basically, HEAT just goes around to the schools during the summertime. They go around to the after school programs and stuff like that, and spread information surrounding the opioid epidemic and what you can do in these situations. So they teach about Narcan. They teach about what does it look like to overdose, what are the signs, what treatment is available, what resources are available close to them. So the main goal of HEAT is just to educate residents on how they can fight to end the amount of lives lost caused by opioid overdoses. Because I know as many residents that are using opioids, there are a lot of residents on the other hand who don't want the opioid epidemic to take over their town, so they're wanting to fight against it. So what does not work? Mobile health clinics do not provide lifelong services to residents in the area. There was an article that was talking about how a lot of low-income areas in the Appalachia are getting mobile health clinics, which they are only drop-in health clinics. They don't stay for a long period of time. So for maybe the day that the mobile health clinics are there, they're getting the treatment that they need as far as like medicine and medication, stuff like that. But when they leave, they don't have anything. So having more long-term facilities there would be a benefit. And then the American Rescue Plan has invested more than $5 billion to do a diagnosis treatment, yet all residents aren't able to take advantage of receiving treatment due to insurance coverage, due to not knowing the types of insurances and what it covers and what it doesn't cover. And then also just not having insurance in general. A lot of them lack that education.
So next, we researched the gaps in services. With that, we found a lack of available substance abuse treatment facilities in rural areas. We can see this just looking at Bowling Green and surrounding areas. There is substance use treatment facility here, but in rural areas, they are not so common. So many times they will have to travel here or travel to other cities to get that assistance. So that's a big barrier that we found. Next, we also found that if treatment centers were available, a lot of times there's a lack of beds, which we can also see with the facility in Bowling Green specifically. You know, there's not unlimited beds. So we can't help everybody or have everyone admitted, which is hard because there's simply not other facilities that are available. So if there's no beds here, then they're not getting the help. So that's also a big gap in services that we have. Again, they also have to travel over an hour away to receive treatment. And this is not just even in Kentucky, this is in other states as well. Many times we'll have people coming from Ohio or Indiana just to come to Bowling Green, or maybe like there's a treatment center in Owensboro, something like that, to get that assistance. So traveling from different states, you know. And then there's a lack of knowledge surrounding different types of insurance or how to apply for insurance. Sometimes people just don't know what they qualify for with their insurance. You know, they may have insurance, but they don't know that they could use their insurance for treatment or for mental health services or something like that. So having education available is a gap in services to let them know how they could use and benefit from the insurance that they have. And lastly, dual diagnosis treatment centers are unavailable in the Appalachia area.
Now to talk about the intervention plan that we came up with based on our research and what we found does work, doesn't work, and other things that we would like to implement. So our goal is to make healthcare services more accessible in the areas with the highest rate of opioid use and overdose, which would be in those counties that Treasure talked about. In our center, we would provide preventative care, which would be like education about the conditions and about things that drugs could lead to, as well as ways to like safely use, like with needles and all that sort of things. Emergency care if someone were to overdose or need immediate medical attention, and mental health resources like counseling, therapy, and support groups. The location of this center would be in Breathitt County, which is between Wolfe and Perry County. It's kind of like, I think Wolfe, Breathitt, and Perry. So they're kind of like vertical, and those are some of the top 3 or 4 counties that have the highest usage. In this center, we will provide the surrounding communities with primary care physicians, detox beds, transportation services, and support groups. These are just a couple of the services listed when doing research. Transportation to these facilities that do offer are further in rural areas. They usually are located in the city. And so people who live in rural areas may not have a reliable source of transportation. So our center seeks to provide those services with no additional cost to our clients, as well as primary care that the physicians are the primary diagnosis of the like opioid use disorder, because that's just, I guess, who they're going to. And there is a decrease of physicians in rural areas. They are either retiring because of old age or they are moving to urban areas. So they are where people seek primary care, those physicians are also diminishing. So we want to fill that gap as well. And then having not only individual therapy services, but support groups where people are able to talk to others about their struggles. This would also serve as a safe consumption space where people can use drugs in the presence of a trained personnel. This has proven to decrease overdoses and increase enrollment in rehabilitation programs.
And lastly, our conclusion, we simply came to the conclusion that opioid use in rural areas is an epidemic. It's very serious, it's very prominent, and it's a lot more serious than many people are probably aware of. So we have been able to research opioid use in these specific areas, like Maya and Treasure said, and learn about the existing gaps in services, as well as what is working and what maybe doesn't work. Our intervention plan is what we think is realistic when it comes to creating possible available services and what we think individuals experiencing opioid use could benefit from. And then lastly, as professional social workers in the future, we may work in rural areas, especially living in Kentucky, which is highly based in rural areas, and work with clients who experience these issues and experience the gaps in services and maybe the services that don't work and the lack of resources. So researching this and being educated on this will help us greatly in our professional future. And these are all of our references, which is where we got our information from as well. And that is our project. So thank you so much.